I opted to have a total hip replacement on the advice actually of my consultant, Mr. Shah, who, when I went to see him about my knee, he advised me that it was not my knee, but it was my hip that needed replacing. So I said, fine, I bow to your better judgment. And he said to me then, if I replace your hip, I should be able to reduce the pain in your knee by up to 75%. That has proved to be absolutely true. In fact, I have no pain in my knee at all, which is quite remarkable. After the operation, I said, what state was my hip in? And he said, very bad. Arthritis completely broken down. He said, yes, it was in a very bad state. And I was getting back pain. It's fascinating that you get all this referred pain. I mean, the hip didn't actually, I can't remember it being painful, but it was all the other associated pains that went with it. When it came to walking, bending down, gardening or whatever, it was always be careful, you know, the pain, which I don't have now. I don't have at all. The care at BMI Goring Hall Hospital was excellent. The pre-op appointments I had were punctual. I was only in for 2 nights, I think it was, and very comfortable. The food was very good, and I've got nothing but compliments. I can't criticize the place at all. I think it was excellent. The morning after the operation, they get you to do your walking exercise as quickly as possible. And yes, I know the corridors at Goring Hall quite well now. At the beginning, you think it's going to take you a long time to get your mobility back. But if you persevere with the exercises they give you, you look back now and you think it doesn't seem to be a long time. You have to try and keep the exercises going. The physios will give you all the exercises to do, and you must do them, because it's imperative. When I came home, I started walking up the lane here, a short distance, back again, and then you just extend that distance. Not necessarily every day, but you extend it as quickly as you can. One of my favourite pastimes is actually walking. And of course, I suppose after a couple of months, I was able to walk a mile, and then I got myself going, and I can now walk. And what are we now? 11 months into the, and I did a 6-mile walk on Sunday. No trouble at all. And I don't really feel any pain at all now. And that's 10, 11 months after. And of course, skiing is another hobby of mine, which of course I was able to participate in January of this year. So that would have been, what's that, 9 months after the operation. I enjoyed the skiing without any of the pain I used to have. And that just made it so fantastic. One of the exercises that I did find extremely good for my hip replacement was cycling. We went on a holiday last year to Germany, where I borrowed somebody's bike. And I did about 38 kilometers in the day. And I came back, obviously a little bit saddle sore, but I tell you what, that did my hip a lot of good. So I go to the gym now and I do a little bit of cycling on the old static bicycle, but without any pain. And I do sort of 20 minutes on the bicycle, which is good exercise. I would recommend Mr. Shah, and I would recommend Goring Hall. I would have no hesitation in going back to him. I would summarize my life now as being pain-free. My plans are to maybe do some walking holidays. I'm thinking of my next skiing holiday. I have renewed optimism for the future. I might be 72 years of age, but I don't feel it.